Hello everyone, this is Tanum Sheikh. I want to represent a presentation on canine distemper. Etiology. Canine distemper virus belongs to the genus Morbillivirus, family Paramyxoviridae. The canine distemper virus is closely related to human measles virus and rinderpest virus. Host affected dogs and other canidae such as coyotes, foxes and wolves. Infection of dogs can lead to a severe multisystemic disease that primarily affects the gastrointestinal, respiratory, and nervous systems. Brachycephalic dogs have a lower prevalence than dolichocephalic dogs. Distribution worldwide. Anatomical sites targeted by the virus. Ocular signs, neurologic signs, pneumonia, enteritis, abortion and infertility, lymphoid necrosis, and opportunistic infections, enamel hypoplasia, nasal and footbed hyperparakeratosis. Mode of transmission: oronasal contact with virus in secretions or excretions, and large particle aerosol transmission. Pathogenesis: virus enters the body, then it gets entry into the monocytes within lymphoid tissue in the upper respiratory tract and tonsils. From there, it enters the RE system through lymphatics and blood. Viral hemagglutinin plus host receptor. The SLAM is expressed by the immature thymocytes, activated thrombocytes, lymphocytes, macrophages, and dendritic cells. Direct viral destruction of the lymphocyte population CD4 and T cells which occur within the blood, tonsils, thymus, spleen, lymph nodes, bone marrow, mucosa associated lymphoid tissue, and hepatic Kupffer cells. Initial lymphopenia and transient fever. Subsequently 8 to 9 days post infection, there is a second stage of cell associated viremia and fever. After that, it infects the respiratory, GIT, CNS, skin, and additional lymphoid cells. In this stage, the canine distemper virus infects a variety of cell lineage like epithelial, mesenchymal, neuroendocrine, and hematopoietic cells and form intracytoplasmic but also internuclear inclusions. The shedding of virus occurs from all the secretions and excretions at 5 days post-infection before the clinical signs develop. Clinical signs. They mainly depend on the virus strain, the age and immune status of the host, as well as concurrent infections with other viruses and bacteria. Respiratory form: fever, bilateral serous and nasal ocular discharges, conjunctivitis, and a non-productive cough and secondary bacterial infection that lead to the development of mucopurulent nasal and ocular discharges and bacterial bronchopneumonia with cough, lethargy, and decreased appetite. GI form: it leads to inappetence, vomiting, diarrhea, electrolyte abnormalities, and dehydration. The nervous form: the neurological signs are often progressive due to neuronal necrosis and atrophy and generally do not resolve, so dogs that recover often have residual neurological deficits. Old dog encephalitis is a misnomer poorly characterized by progressive immune-mediated demyelinating leukoencephalitis, which occurs week to years after recovery from the acute infection and is difficult to diagnose. A myoclonus involuntary twitching of isolated muscle groups or chorea is common when affected puppies are at rest. A chewing gum seizure, which localized to the head and jaw with accompanying foamy hypersalivation. Ocular form include blepharospasm, photophobia, uveitis, chorioretinitis, keratoconjunctivitis sisa, keratitis, optic neuritis, which may be associated with blindness. Enamel and dentin hypoplasia in recovered animals. Cutaneous form: there is hyperkeratosis in the regions of footpad and nasal planar epithelium. Puppies with hyperkeratosis are known as hard bed that have thickened crusty foot pads that resemble those of adult dogs. The most common secondary infections in distemper are secondary bacterial infections that contribute to bronchopneumonia is Bordetella bronchoseptica. The transplacental infections may cause high infertility, stillbirth, or abortion, and with neurological signs in puppies that are less than 4 to 6 weeks of age. Dogs that have recovered from canine distemper virus infection may develop enamel hypoplasia, chorea, keratosis, and Mendelian lesions, that is healed chorioretinitis, and hyperreflective circular lesions. Diagnosis: clinical signs and symptoms, especially monoclonus. In dogs with respiratory signs, the presence of conjunctivitis, blepharospasm, and ocular discharge should raise suspicion for distemper. The distemper should always be considered as a diagnosis in young dogs with neurological signs. Microbiological tests. These include virus isolation, cytological demonstration of the CDV inclusions, ELISA assays, serology, and RT-PCR. Treatment and prognosis. Dogs with severe respiratory and gastrointestinal disease require IV fluids, antimicrobial drugs, or antimicrobial drug combinations such as ampicillin and a fluoroquinolone. A single IV dose of dexamethasone or tapering anti-inflammatory doses of glucocorticoids has been advocated to halt or reduce the severity of progressive CNS signs. Oral vitamin A and C may be advocated. Anticonvulsants such as diazepam, and for chronic management, potassium bromide or phenobarbital can be used to treat seizures and prevent the spread of a seizure focus. Note: the prognosis for dog with severe neurological signs is poor. Immunity and vaccination. Immunity to canine distemper virus requires antibodies as well as cell-mediated immunity. Disease can be prevented through immunization with attenuated live or recombinant vaccines. Attenuated live vaccine should be given at greater than 6 weeks of age. For dogs older than 16 weeks of age that are brought to the veterinarian for their first vaccination, 2 doses of vaccine should be given 3 to 4 weeks apart. Notes to remember: attenuated live canine distemper virus vaccine. Virus can cause encephalitis, which is administered to immunocompromised dogs and puppies less than 6 weeks of age. Post-vaccinal encephalitis usually occurs 3 to 20 days after vaccination, associated with certain batches of vaccines that contain the rock-borne strain. The attenuated live canine distemper virus vaccines to dams immediately after whelping has been associated with the development of encephalitis in the puppies. Thank you.